Hello, everyone, and welcome to a new episode of Med Speaks. Today, I'm joined with a very special guest.
Hi, I'm Aditya Daftary. I'm a radiologist. I work in Mumbai, and I'm very happy to be here to
Thank you
chat with the
so
great Kabir
much.
Singh.
Thank you so much for coming on. We are rocking the chashma today. So,
That's right. These are X-ray goggles, by the way.
oh really?
Yeah, that's why I'm a
These are
radiologist.
first question. Where did you do your high school, like 9th to 12th?
I went to a really fancy school. It's called the Cathedral and John Convent School. It's a very fancy school. Based in Mumbai. People have given an arm and leg to be there. Well, that's where I went to school. It was a great place to be, but it's even nicer to be out of it now. Yeah, it's a good place. That's where I went to school.
How was your, overall experience over there?
I can't say anything about my school experience publicly because if I speak truly, then I can get hurt. But honestly, my school experience was quite good. I had a lot of good friends. I think at the time that I was in school, it's a bit different from when what it is like now. It wasn't as intense. We had the opportunity to explore a lot of different fun things. And so I really enjoyed my school. I never came first in class or second or third, except from the bottom. But I think it gave me great perspective and like I said, great friends.
Perfect. Well, I guess the arm and leg was worth it.
Yeah,
So,
absolutely.
going on to, NEET and MBBS experience, I know probably during your times, NEET wasn't there, but could you compare
I'm kind of
from
old,
your time?
I'm like old, that. So we don't have NEET actually. We used to go like into a cave, and then you had to like sit with two rocks, and if you could rub them together and make fire, then you passed the exam, and then you could go into medical college. That's the kind of night we were from. But
I wish it was like that
no,
now.
yeah. I mean, nowadays you can't even find rocks, but that's okay. But yeah, no, we were at a time when we had to just take our 12th standard exams, and based on those glorious marks, you got into medical college. We Obviously there were a lot of people who worked very hard and studied very hard. I would say I tried, but eventually to get into medical college, you just took like my time. I just took my marks, and I said, okay, I've got marks for. I'm putting my form in dentistry, I'm putting my form in medicine, and I'm putting my form in biomedical engineering. And whichever one comes first, I will take that. And that's how I got into medicine.
So medicine came first.
Medicine opened its doors to me first.
Very lucky, I would say.
Yeah, absolutely. Not for medicine, but for me.
Now, could you kind of talk about how the situation is now with NEET, how people have to prepare? Is it harder? Is it easier than your time?
Yeah, I mean, I don't know. I think it's definitely very competitive, and I wouldn't say it wasn't competitive, but there's a lot more pressure, I think, on kids who are trying to get into med school now. There's a hell of a lot of studying to be done. There's a hell of a pressure. And I think what's happened is because the systems have become so well structured, people have to really just, they really have to just learn X number of things completely. And in learning those things in their entirety, it's become like percentage. It's just all about how much you can get right all the time. There's no variability that is basic. So I think it's just if there's 1,000 questions, there's 1,000 questions, you should know the answers to all of them. If there's 1,001, you should know 1,001. If there's 1,025, you should know 1,025. And the person who remembers all those answers best wins on that given day. Right. So the pressure is very, very high. And it's, I can guarantee you that none of those questions in that exam are useful in life. But nevertheless, they're there.
Yeah. I mean, I think as of now, NEET really gears people to just memorize. And I don't think that's the best way to learn medicine, which is something really you have to apply. There's no...
NEET has got nothing to do with medicine.
Oh.
The NEET exam has got absolutely nothing to do with medicine. It's just what they consider as a test of basic intelligence to get into medicine. And I can tell you that that's not even a good test for it. So, but it's a rite of passage. They don't have a choice, right? They have to create an equal level playing field to take people into medicine.
Yeah.
And that's why they do that.
Fair enough. do you think undergrad in India is better or worse than undergrad abroad before you go to med school?
Oh, before going to med school, you don't have to do undergrad here. You go straight out to 12th standard here.
Right, but then abroad you have to do, bachelor's and something.
Right. So I think the reason to do a bachelor's or something before medicine is like, it comes to a conversation that we might have later, is that it's all about perspective when you become a doctor. The more life experiences you have, the more perspective you have, the better off you are to deal with patients. So having an undergrad training time where you've got to see that much more of life before you go into medicine, make sure that you're that much more committed to medicine. Here it's almost
Right.
like a rat race. You want to get to 12 and then get into medicine.
Right.
And that's because there's no choice. You've not had a chance to explore anything else.
Hmm.
So that undergrad gives you 4 years to explore other things, to see the rest of the world, to see what life is about, and then decide if you truly want to do medicine. So
Hmm.
I think that's one of the big things as far as why I think an undergrad thing is interesting when you do medicine.
Fair
That being
enough.
said, you want to get out and start practicing sooner, and therefore you don't want to do undergrad. So I
Yeah.
think those are, so I'm in favor of having at least some years where you get to think about whether you want to do medicine or not.
Uh-huh. But then I think those years abroad are very expensive, especially if you go to a premium school like
Yeah.
an Ivy or
Well, I
something.
mean, and then once you go abroad again, you have to come back and take the NEET. Would you do that? I don't know.
Right.
Right? Because then you would just explore staying over there because the systems are so much more geared to accepting people out of those training programs over there than over here.
Fair enough. Okay. And so which medical college did you go to?
Oh, I went to a place called Dr. D.Y. Patil Medical College in Navi Mumbai.
Okay.
And it was in its third or fourth year of existence when I went.
Oh,
Yeah, so we were one of the early batches, but it was a lot of fun. We had a really good group of, and I think that's one of the things in medicine is your med school class almost makes or breaks your entire med school experience. So if you have a great class with great friends, you have a great time, and it seems like you're getting through that whole experience is a breeze. And on the other hand, if you are in some toxic environment, then every day seems like it's an ordeal,
yeah.
and you're more likely to tap out. Yeah. So yeah,
Okay.
we had a great time. We had a lot of fun in medical college. I used to bunk class, yeah, and go to cricket matches, and then get caught on TV being watched by the professor who was giving the class, and then going the next day and saying, "I'm sorry, I couldn't come to school because I wasn't well," and then he says, "Really?" So yeah,
That sounds a
it is
lot
what
of
it is.
fun.
Yeah, it's
I mean, a lot of people make med school out to be just like a bunch of these sweaty nerds in one class just studying all day. But I don't like med students are also humans. They also like to have fun.
oh no, med students have a lot of fun. I can tell you they're among the crazier people out there. There are two books that you should probably look at. I think there's one is called My Medical School, which is a British book, and then there's another one called The House of God, which is an American book, and they're both about like med school / internship experiences, and they're really funny and they're very very interesting to look through for those of you who want to look at the fun side of medicine.
I'll be sure to link them in the description.
All
Okay.
right.
Then we have so could you give us like a brief overview of the years to become a radiologist and what you have to do in each year?
Okay, so first thing is you finish your MBBS. Once you finish your MBBS, if you're in India or wherever you are, you have to go through a rite of passage again. So some sort of either exam or selection process to get into a radiology program. The radiology training program in India is a 3-year program. The radiology training program in the US is a 4-year program. I don't know about the training programs in the other places. Um, Normally, in your first year, they would focus you on what they call other basic modalities, so X-rays and ultrasounds. In the second year, they would add more of ultrasound and CT. In India, they put more emphasis on ultrasound because a lot of people go on to become sonologists because it's an easy modality to buy and set up. And then you have, beyond that, you get into in the final year, you'll be doing more CT and MRI, which are again more expensive modalities when people consider them to be a little bit more advanced. So you do that. That's a typical training program. After that, most people would go on to do what they call post-PG training. So they would still do posts at hospitals to try and get additional experience. And then some people might consider doing some subspecialty training in subspecialty fellowship areas like neuroimaging or orthopedic imaging or pediatric imaging or interventional radiology. So you could have a bunch of other training, other areas that you go into.
Okay, and through your knowledge, what is the pay of radiology residents? How much, like, ballpark?
I think it depends on the institution. So they're paid about the same as any other resident when you're in residency. And that may be in the range of, I don't know, I want to say 40,000 rupees a month, going up to 70,000 rupees as you get more senior. If you are when you get out of radiology, first jobs are in the range of 1.5 to 2 lakhs a month. And then when you get to being a more senior radiologist, maybe you're looking at more like 4 to 5 lakhs a month. And then if you run your own center and whatever else, then you would make more of that.
And I'm guessing that this pay is much more abroad.
Yes. And so in the US, if you looked at it, the average radiology salary a few years ago was about average, that includes academic and non-academic, was closer to $300,000 a year.
Oh, wow. So that's like 30 lakhs a month.
Yeah, whatever, $300,000 a year, do the math. I don't remember what it is. But that's average. I mean, if you go into private practice, most private practice radiologists would be making somewhere between $500,000 to $750,000 a year or more.
What?
Yeah. Why would you want to be here?
That's an insane jump from what radiologists earn here.
Correct. But then by the same accord, you think about it, the cost of an MRI scan in Mumbai is 8,500 rupees. In the US, it would be somewhere in the range of $1,500 to $2,000. I mean, of course, insurance has a big way in reducing those prices or whatever. So the price X is also about 100X, if you think about it.
And also, like if you study medicine in the US, it's much more than if you were to study here.
Much more expensive, correct.
Then we have, what was your experience as a foreign medical graduate, like post your med school in residency in the US? And could you just give us a bit of a background as to where you studied and how it was?
Yeah, so it was a fun experience. I had to go. I'm not very clever, as you know, so I had to take. I took the entrance exams. I didn't have the greatest of scores. I worked as I did 1 year as a research fellow. Worked in a department, and then I applied in that department, and they obviously didn't have any positions for me because I was too stupid. So then they gave me a position in a branch called nuclear medicine, where they had a last minute opening. So I did that, and I got to know some people. Then I learned some stuff there. Then I had trouble getting into an internship, and then the one thing that I learned that was phenomenal over there is, while there is a lot of so-called xenophobia, not massive, but where it would be harder for you to get in, there's also a lot of people who are willing to go out of your way for you and who don't know you at all. And I can there's a couple of examples of people who've just gone completely out of their way for me. I mean, I remember I was applying to a residency program for the 3rd year in a row, and the entire committee said, well, why are we hiring this fellow? He's applied 3 times, there's no reason to take him again. And somebody in the committee just said, listen, if you look at his application, every year that it's come back to us, it's stronger, it's got more publications, it's got more things in it, and there's no reason we should be denying this person. And plus, we've got all our own residents supporting his application. So, I mean, I would never think of a place where, I would have never thought in India that you would have an entire group of residents and some faculty just backing a person and saying we want them in the department, and therefore the department taking a call. There's a time that I was applying to a program for bone and joint imaging, and I told them I wanted to move back to India. And one of the people, and they said, oh, so we're not taking him, he's moving back to India as a foreign medical graduate, etc., etc. And one of the people in the committee, I was told, said, well, do you want to say that you trained one of the best musculoskeletal radiologists in India, or do you want to say you almost trained him? And I think I got into the program, and they made a big mistake, but that's a different story. But what I did learn over there was just tremendous amounts of lateral thinking, openness of thought, coordinating. I worked with somebody. I was doing nuclear medicine, and I worked with somebody who's doing geriatric medicine. I had conversations with people from so many different fields, even though I was doing radiology, and you just learn to laterally think so much. So I think from that standpoint, the experience out there is just unmatched. Here it tends to be very focused and so that standpoint, I think it's very, very important to go there, to look at those experiences, to learn from those, and to bring back those thought processes here. So yeah.
Fair enough. Could you just give us a brief overview as to what nuclear medicine has under its belt?
Yeah, so nuclear medicine is when you flip the word, the first two alphabets, it's called unclear medicine. That's exactly what it is. No, I'm just kidding. Nuclear medicine is essentially using radioactive materials, so radio tracers, inside the body to try and diagnose conditions or to try and treat conditions. And what do I mean by that? So you have a bunch of different radioactive materials, some of which are what they call gamma emitters. Now, these don't produce as much destruction inside the body, and they're very sort of, radiation that flies through the body. So what you do is when you give somebody with these agents, they go to different parts of the body, and you can have a detector above it, and that detector will create an image of where the radio tracer is in the body. And so using that, you can determine how a radio tracer, how that part of the body is working. So let me give you an example. There's a radio tracer that tracks to bone, okay, and it looks at how fast bone is growing. And what it will do is, if you gave it into the body, it will go and distribute itself evenly across the bones. Okay. But supposing you had a fracture is a place that the moment you have a fracture, the bone wants to grow and heal the fracture. So obviously the bone is working much harder over there than anywhere else. Mm-hmm. So that particular area would take up more radio tracer and would appear hotter on the scan than on something else. Oh. So that's one way. And the other way that's very popularly being used today is there's you guys may have heard of something called a PET CT scan. They do that in cancer. Mm-hmm. A PET CT scan, what they do is they take radioactive sugar, like radioactive glucose, and they inject it into the body. Now, what do cancer cells do? They're growing very fast, right? They use a lot of glucose. So this radio tracer goes and attaches itself to those cells more than any other cells. So when you're looking at the whole body scan, you'll see where the cancer is. It lights up like a light bulb, and the other parts of the body, it's not as lit up. So that's why we use it for things like that. So there's a whole bunch of different things we can use it for, but these are some of the common ones.
That's so fascinating. And I bet, nuclear medicine is a really unsung hero in the whole cancer treatment process.
Yeah, so the treatment process, yes, it's important because nuclear medicine helps us to better stage and understand the spread of disease and the location of disease in cancer, but also in a lot of other diseases. Mm-hmm. So it's one more thing we have in the arsenal, and it works very well.
That's really fascinating. Now, so what are the other super specialties in radiology? Like, as you were saying, nuclear medicine. What are some other types?
Yeah, so other things that you can do. I remember that, so in our country, in many places, you become a specialist in what you own. So if you own an X-ray machine, you become an X-ray specialist. If you own an ultrasound machine, you become an ultrasound specialist. If you know a CT scanner, you become a CT specialist. The problem is that diseases don't know that they should show up on a CT scan or an MRI or an X-ray or what they should show up on. So, and doctors are not CT doctors, MRI doctors, X-ray doctors. Doctors are neurosurgeons, gastroenterologists. So medical specialties are broken up based on an organ system and things like that. So now the trend is more towards radiologists also being divided like that. So now when you have radiologists, we have radiology specialties like neuroradiologists, so those who will read scans of the brain. Orthopedic radiology or bone and joint radiology is what I do, which is we look everything to do with bones and joints. Mm-hmm. Then you would have, abdominal radiologists who just look at the abdomen. Pediatric radiologists who look at pediatric issues. Interventional radiologists who look at things where they try to put things into the body under image guidance to try and treat or manage different conditions. So there's a whole slew of specialties in that range.
So an example of interventional radiology would be angioplasty, right?
Yeah. So angioplasty, interestingly, everyone associates with the heart.
Uh-huh.
And it's true that radiologists are the people who first started using angioplasty. And then the cardiologists took it over because they saw it was very lucrative and they could use it. But angioplasty is essentially the process of putting a tiny tube or a catheter into the blood vessel, taking it to the area where there's a problem, and then either inflating a small balloon to widen a narrowed blood vessel or putting a small spring like stent to keep the blood vessel open. Yeah, so that's essentially where interventional radiology goes. So that's one example, but we use it for many other things.
That's really fascinating. I mean, I didn't know that radiologists started, the treatment of, I mean, angioplasty. I always thought it was
Nobody knows
cardiac
about
surgery.
radiologists. We are the true unsung heroes of medicine.
Yeah, for sure.
We're actually we're Instagram for doctors, right? We just look
That's
at pictures
true.
and
I
go
didn't think of it
like,
like that.
right?
What are the types of filters, I guess?
Filters, yeah. Most of the filters are like, I didn't see this. I don't know what to do with this. Send this to somebody else. Those are the kind of filters we have.
So, what are, the different types, I mean, what's the difference between radiology and other medical specialties? I don't want to say radiologists is the best because you are one, but
Because we know it's the best. I mean, but that apart, yeah. So radiology is different from other. We're a diagnostic specialty primarily, so we focus on diagnosis. Our people who we don't usually come into direct patient contact unless we're doing a test which involves that. So like an ultrasound, we would hand the probe and be right next to the patient, but otherwise you would go into an MRI scanner, go away, and you'd never know who your radiologist is, right?
yeah.
So we're like sort of a little bit of an unseen branch. Our primary communication would be with the referring doctor, not so much with the patient. Because if I come and tell you a bunch of things, we're a piece of your puzzle. Everything that we see is not the truth in terms of your management. So radiology is different a little bit from that point. We're a diagnostic specialty, as opposed to one where we are face to face with the patients. So that's the biggest difference between radiology and other thing. And the other thing is we use a lot of technology. So we have a lot of fancy toys to play with, X-ray,
Yeah.
ultrasound, CT, MRI, which everybody else doesn't get to play with.
Yeah.
So yeah.
What about in terms of lifestyle and, pay and things like that?
For pay, I already told you, and you were wowed by it, and you're wondering why we're here and not. But
so lifestyle-wise, radiology people say is fixed hours. You come into work at 8, 9 o'clock, and you leave by 5 o'clock. That's what people say. But I think when you look at private practice radiology, remember we are always responsible to the clinicians. So oftentimes we have to work longer hours because we have to be around when they are. So radiology can be lifestyle-wise quite stretched. Also, if you're a clinician, you can say, I'm going on vacation, tell my patients to come next week. As a radiologist, you are not responsible to a given patient necessarily, you're responsible to a bunch of referring doctors. So all those doctors don't go on vacation at the same time. So you do have to, so we explore more the role of us working in a group practice and trying to work those things out. So I think from a lifestyle perspective, while yes, we are not necessarily responsible for being there for a patient in an emergency all the time, we certainly need to be in a position where at least one of us is available, so that if there's a study that is done that requires interpretation, one of us is available. Otherwise, it is one where you can have a little bit more balanced lifestyle than many other specialties. Most practices, if you're a reasonably busy person, it's quite tiring because you're looking at a lot of images all the time, so it's quite straining on the eyes. You don't usually have a lot of time between one scan and the next. Some CT scans can be a few thousand images, so you're trying to look at those like in a short period of time. Some MRIs can have a fair number of images. So it can, I mean, I always find radiology a little bit more taxing than everything else, just because you don't get as many breaks if you're busy. So yeah.
Okay. Now, why did you in specific want to do radiology? Like, why radiology? Why not surgery? And,
So yeah, I mean, one is I was too dumb to get into surgery, but more importantly, I think with what you find is that when you start out in medicine, you will usually find a role model who motivates you and excites you to take on what you do. And for me, it was a cousin of mine who was a radiologist at Bhatia Hospital. And when I was a medical student, I used to get off at Grant Road Station, and he was right there. And he always had a great lunchbox, which was always ready. And so I would always stop off once I got off over there to go visit him and have lunch from his lunchbox. And then when I was there, I started looking at the images and I started looking at what they were doing, and I thought it was cool. And I also realized that the place they had, lots of people came by, stopped by, other doctors. They always had a good laugh. It always seemed like a place that was sort of the hub of life in the hospital, and fun place. So I kind of enjoyed that aspect of radiology. So it was, you get to learn so many things, you get to play with all these toys, you get to have a somewhat balanced lifestyle, and you can always be innovating in the space. So I think all those things really excited me about radiology. For me, my other area of excitement was orthopedics, because similarly, I had a mentor in orthopedics who, allowed me to operate and learn and do things. And so I had this, I ultimately went on to just marry both of them. I did radiology and then I focused on orthopedics. So now I do both things I love a lot.
Right, you do bone and joint radiology, right?
Right.
Now, coming to something that I have never asked a doctor before, but it was a very good question that you brought up, which was how are doctors now preparing for AI entering medicine? And do you think it'll take over?
So I think this comes down to us talking about two things. So what is medicine? It's about collecting a whole bunch of data points. And when we collect all those data points, we're trying to put them together and create information. Now, you can have errors in these data points. You can have errors. You can forget to collect data points. So I think AI will play a great role in making sure that when we have certain data points, it allows us to look at them systematically, and it makes many of our more difficult or mundane tasks much more accessible and us more efficient at those. So it should make us have much fewer things fall through the cracks. And because those mundane tasks go away from us, we're able to focus on bigger issues. And the example we talked about was, in a world without calculators, we spent a lot of time doing manual math.
Yeah.
And people told us we became smarter because we did manual math. But today, when we have a calculator, we're still like equally smart. We're just using our brain towards something else. So I think with AI coming in, we will essentially, what we will do is we will take those parts of our lives that we don't like, put them into AI, get the answers that we need, and then we will continue to evolve better. So is AI going to take over medicine? To some extent. When will it take over? Slower than they say, faster than we think.
Okay.
And will we be better? Will we be better physicians as a result of AI? Well, I don't know about that, but I know certainly those people who are able to harness and use AI to its maximum will be better physicians than those who ignore and don't use AI.
Okay, and I think AI would never be able to completely take over medicine, because AI would never have a doctor-patient relationship, because it's a robot. It doesn't have emotions.
Yeah, I mean, those kind of things will come eventually, but I think there is still a lot of subjectivity to medicine. Now, it's not just about that I have A plus B equals C.
Right.
It's A plus B equals D, but I don't know if C, F, G, H, what is the thing that I have to add in the middle to get to the answer D?
Right.
And that's where you have a lot of subjectivity. And until and it's your experience that helps you to understand that subjectivity, to fill those gaps and get you to D in the best possible way.
I think that was a great way to put it. Now coming to India versus US for medicine, do you think doctors should go? Do you think they should stay?
Personally, I'm the kind of person who believes that in India, we can only grow if we decide to grow ourselves in India. So my vote is always for coming back to India. It's challenging, it's hard, it's difficult, but it's home. It's where you are, it's where your family is, it's where, why wouldn't you want to make a difference here? The answer is easy to go to the US. It's cleaner, it's nicer, the pay, as I told you, is much better. And so, hey, you should be looking at going to the US. Why would you waste your time here? But why would you waste them? Because you owe it. You're just much more responsible to people here, and you can make a much greater difference here than going there. So I'm all for staying here. I'm all for, if you're from a small town, stay in the small town. If you're in a big town, stay in a big town. If you're in a big place, go to a smaller place even. But take better healthcare everywhere where it's really needed. Stop trying to create better healthcare where they are already overspending on it.
Yeah, I mean, I guess there are arguments to this, like people who are smart should stay here and help the our population and as a country grow. But then the smart people can say, well, I am more enabled to use my smarts abroad.
Right.
So I guess it's
You're
something.
not that, but you're not that smart if you're more enabled to use your smarts overboard. Like if you're really smart, then you'll use your smarts over here because that's where it's harder to use your smarts.
And if you're really smart, you'll be able to use your smarts anywhere. So
Exactly.
I
Exactly.
guess it's a
It's
cycle.
a really smart observation you made.
Okay, now this is another thing that doctor wanted me to add, which is what is the art of medical sciences? And there's science of medical science, and then there's art of medical science. So what is it?
So I think art is just your ability to connect with people, to understand a person as an in their entirety, and not to look at them as an equation that says this is your clinical story, this is your findings, therefore you should be treated as this. It's about, even when I talked about it, it's where you realize that A plus B equals D, but you have to figure out what that middle ground is to take it to that last thing. So I think where you think about is you use your experience. You say, listen, I've treated 10 people with this. The first 5 I treated this way, they didn't do well. The next 5 I treated did well. What was the reason why it worked on these 5 but not on these 5? And then you start to make your own judgments and your decisions, and that's experience and maturity that takes you there. So I think the art of medicine is about how you are mindful of the outcomes you've had based on what you did and how you apply them to the future of your practice.
So how you
And
kind of
somehow,
learn from experience and
exactly. And that's something that's very hard to, I can teach someone how I think about it, but I can't make them me immediately.
right. And I think art of medical science is never, it's not taught in medical school. It's just it's things you learn.
You're expected to observe it and learn it.
Yeah.
You're expected to observe it and learn it, but nobody ever tells you, hey, this is art of medicine I'm using here. That kind of thing.
Yeah. So I think another important part of art of medical science is how you are with a patient. If forget the whole how to treat them, just the way you talk to them about their life, their job, small talk. And I mean, I've had great experiences with doctors who, while they're doing when I got stitches on my eyebrow, he was quizzing me on chemistry and exothermic reaction and things like that. So
Yeah.
it really made the whole thing much more interesting and much more fun.
Right. Like, so, it's useful. It's a useful skill in many ways. Like one of the doctors says, I always ask patients, oh, how are you? How are you doing? Where was your last vacation? And they say Europe. I know I should increase my bill. If they say, it's basically about creating a connect with the patient. The moment the patient realizes that you're more than just an interaction for a medical reason, they're more inclined to sort of believe and be with you and sort of understand what you're doing, and you're more likely to get them to comply with what you say.
Absolutely. Coming up to the last three questions of this really boring interview, I'm sure,
Right.
is what in your opinion, in your experience, what have been the drawbacks of radiology?
I think you're like, the biggest thing is that nobody knows who you are, and everybody likes to be important. And
Yeah,
because you're hiding in the back in a dark room, just like doing Instagram for doctors, nobody really knows about you. So that's, I think, the thing. So on the plus side, when you start, because it's a job and you're doing X amount of work, you get paid X. But then because your value or your billing doesn't increase incrementally, you don't really start to see a steep rise in your salary. So you're pretty much, you don't have that much of a growth component there. That's one thing. Some people say you don't have interaction with patients, you don't like it. Those kind of people don't go to radiology, so they shouldn't complain. I should go somewhere else. But I would say that's sort of the bigger drawbacks of radiology, if at all. Yeah, I mean, I'm not sure that there's any other major drawback that I would see in it. it's expensive because you have to buy expensive toys and play with them. So
Yeah.
that I think that's an issue.
Well, then, what are the upsides? I mean, I'm sure if there are many.
It's
Yeah.
awesome, right? I mean, you've got great pay, you've got you got toys to play with, you've got a good life balance you can create for yourself. You're not responsible for anything. You just take pictures and you swipe and you say like, dislike, drop, share. You just do things like that. So in that sense, it's a great subspecialty. And plus, it's constantly evolving. It's very exciting. There's a tech angle to it. So I think on many levels, radiology is very exciting as a branch to be in, at least for me.
Now that we kind of spoke about radiology, I'm sure there are some upsides of medicine as a whole that tie in together with radiology.
Yeah, I mean, I think radiology is really, I mean, medicine and radiology are awesome. And for those of you who don't know, Sherlock Holmes is based off of a doctor. So the fact that you're constantly solving mysteries and you're really smart, it certainly has its little charm to it. You also have this little concept of like, you're playing God because you can tell people what's going to happen to them. And you can do, so there's a lot of things. I had a very funny story. I used to have an interventional radiologist I worked with, who was from Israel. And he says, Aditya, when you're a radiologist, you're like God, because only God can see inside the body, nobody else. So I think these are some things that I think there's various things. There's at an egotistical level, it's like, oh, I'm very smart. I feel very smart. I feel very aware. I feel, I can control things. I can make people feel better. You get that sense of power.
Mm-hmm.
From an internal satisfaction perspective, you feel that I'm making a difference to somebody's life. I can actually help someone. I can do something for someone. From a financial perspective, you say, listen, what kind of job do you have where you can feel like God, you can make people feel better, and you can make a good living out of that. So I think, those three things.
Yeah.
And then yet, like most things, you need a place to complain about. It's got enough things to complain about. So it's like almost the complete profession you have right there. So I think medicine is right there. It's got all the good stuff and something to complain about. So it's fantastic.
Perfect. You can just rant whenever you want, but then also be like, well, I mean, I am God.
Yeah, exactly. So yeah.
Coming to the last question, what does life look like for doctors after medicine, beyond medicine, outside of medicine?
Sucks. No, it's actually good. It depends on the doctor. So some people like to drown themselves in medicine and be in medicine all the time. But most successful physicians you'll find will need to do something outside of medicine, because it helps to calm the mind, keep you sort of straight, prevents burnout, talked about earlier.
Mm-hmm.
So I think most people would look at things like hobbies, and a lot of doctors have a lot of different hobbies, and they usually don't involve the phone. They involve things like it could be sports. So I have a 67-year-old doctor I work with who 2 years ago did something called the jog, which is cycling from the bottom end of England to the top end of England, like all the way across the continent.
So he was
We have
65.
65, 66 when he did it. Yeah. We have a group of us as doctors who cycle all over the place. We know doctors who perform at singing shows. I know a radiologist in Pune who sings on All India Radio. So there's a lot of fascinating things. We know a lot of professional dancers. So there's a lot of fascinating things that doctors do with their spare time, and I think that brings a lot of perspective to their lives. It allows them to practice the art of medicine that much better. It allows them to relate that much more with patients. So I think it's very, very important for doctors to have a life beyond medicine. And of course,
Right.
there's family need to be responsible too. So
Yeah.
sometimes.
And I'm sure, like, if people don't have a life outside medicine, they only think about medicine, then they'll genuinely obviously get burnt out and they'll start to dislike it, because if you're just slogging your way through something like so much and it's the only thing you can think about, then
they're bad people. Very bad people.
Yeah. Well,
So, yeah.
thank you so much for coming on, Dr. Aditya. It was a pleasure. I had so much fun. We had a laugh and it was
so much. Yeah.
Complete interview. And
Great.
I'll see you guys in the next video.
Cheers.